Well, new here at 10 o'clock as Colorado reports the first U.S. case of a new potentially more contagious strain of COVID-19. Oklahoma is reporting a record number of COVID-19 hospitalizations. 2 Works for You's KJRH shares what doctors are saying about the new COVID strain and why doctors are worried here. Katie?
The Oklahoma State Department of Health website shows all Oklahoma hospitals are in Tier 3 of the state surge plan. And with the state setting hospitalization records, doctors fear those numbers are going to rise over the next few weeks.
We're stretched. We have more COVID patients in the hospital today than we've ever had.
Hospitals trying to hold on as Oklahoma records its highest number of COVID-19 patients hospitalized so far, with 1,927 COVID patients hospitalized Monday night. That number worrying doctors as people travel for the holidays.
In 10 days to 14 days, we're going to see a substantial surge in the number of cases in Oklahoma that get reported. And per David Kendrick's data in the past, 10 to 12% of those people were going to end up in a hospital.
Another concern, new strains of COVID-19, including one found in the UK, now traveling around the world, with the first known case found in Colorado Tuesday. Dr. George Diaz is the infections prevention manager at Providence Regional Medical Center in Everett, Washington. He was the first to diagnose a patient with COVID-19 in the U.S. Speaking with the Healthier Oklahoma Coalition COVID-19 Task Force Tuesday afternoon, he says the new strains are more contagious and are infecting more children.
Thankfully, they haven't reported any increases in mortality to date, so that it's causing more infections within that country. More hospitalizations is responsible for the surge that's occurring there.
He says the vaccine is still effective against the new variations of COVID. Doctors say at least 70% of the population needs the vaccine to have herd immunity. If not,
this may be a mechanism by which, over time, much like the flu vaccine that we take yearly, as new variants are identified, we may have yearly new COVID vaccines that we'll be taking to better match the circulating strains that are occurring worldwide.
Doctors encourage everyone to continue following the 3 W's. Wash your hands, watch your distance, and wear a mask. Katie Kelleher, 2 Works for You.